This is my student support system. Keep watching, keep learning.
Spinal nerves. There are 31 pairs of spinal nerves which are part of peripheral nervous system. These nerves are attached to the spinal cord, which are named and numbered according to the region and the level of the vertebral column from which they come out. Here you can understand that these 31 pairs are named as 8 pairs of cervical nerves which come out of the cervical area, then 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and there is one pair of coccygeal nerve. The spinal nerves provide a path of communication between the brain through spinal cord and the specific regions of our body as they connect central nervous system to sensory receptors, muscles and glands in all the parts of body. A typical spinal nerve have two connections to the spinal cord. These are posterior nerve root and anterior nerve root, which unite to form the spinal nerve. Here you can understand this is a spinal cord and these are two roots. Okay, both sides. So these are posterior nerve root, these are anterior nerve root. So posterior nerve root contains the sensory neurons and anterior nerve root contains motor neurons. After coming out intervertebral foramen, a spinal nerve divides into several branches and these branches are known as rami. The posterior rami serve the deep muscles and skin of posterior surface of the trunk. The anterior rami serve the muscles and structures of the upper and lower limbs and skin of the lateral and anterior surface of our trunk. Now what is plexus? There is a special system. You can get a short note on plexus in your exam. So axons from the anterior rami of spinal nerves, not all, maximum, except thoracic nerves T2 to T12. They do not go directly to the body structures they supply. Instead, they form a network on both left and right side of the body by joining the various numbers of axons of anterior rami of adjacent nerves. And these structures or these network are called as plexus. So there are many plexus. First we will discuss the cervical plexus. Cervical plexus is in the neck. The cervical plexus is formed by roots of first four cervical nerves, that is C1 to C4, and some part of C5. There is one on each side of the neck alongside the four cervical vertebrae. The cervical plexus supply the skin and muscles of head, neck, and superior parts of shoulders and chest. The phrenic nerve arise from the cervical plexus and supply motor fibers to the diaphragm and help in respiration. Second is brachial plexus. The anterior rami of spinal nerves C5 to C8 and T1 form the brachial plexus, which extend inferiorly and laterally on the either side of last four cervical and first thoracic vertebrae. The brachial plexus pass above the first rib and then posterior to the clavicle and enter into the axilla. The brachial plexus provide almost entire nerve supply of shoulders and upper limb. The main nerves of brachial plexus are the axillary nerve, which supply deltoid and teres minor muscles, the musculoskeletal nerves, which supply the anterior muscles of arm, the radial nerves, which supply the muscles on the posterior aspect of the arm and forearm, the median nerve supply most of the muscles of anterior forearm and some muscles of hand, and the ulnar nerve supply the anteromedial muscles of the forearm, and most muscles of the hand as well as skin. Now thoracic nerve. The anterior rami of spinal nerve T1 to T12, they do not enter into the formation of plexus and are known as intercostal or thoracic nerves. These nerves supply the skin and muscles in and around the intercostal space, front and back of the thorax. Next is lumbar plexus. The lumbar plexus is formed by the anterior rami of the first three and part of the fourth lumbar nerves. The plexus is situated in front of the transverse process of lumbar vertebra. The lumbar plexus supply the anterolateral abdominal wall, external genitalia, and parts of lower limbs. The largest nerve arising from lumbar plexus is femoral nerve. Other nerves of lumbar plexus are iliohypogastric nerve, ilioinguinal, genitofemoral, lateral cutaneous, and obturator nerve. Sacral plexus. The roots of spinal nerve L4 to L5 and S1 to S4, they form the sacral plexus. This plexus is situated anterior to the sacrum. The sacral plexus supply the buttocks, perineum, and lower limbs. Sacral plexus supplies the buttocks. The largest nerve in the body is known as sciatic nerve, which this arises from the sacral plexus. The sciatic nerve is largest nerve in the body and it is about 2 cm wide at its origin, and it passes through the greater sciatic foramen into the buttocks and then descends through the posterior aspect of thigh, supplying the hamstring muscles. At the end, at the level of mid of the thigh or femur bone, the sciatic nerve divides into two, tibial and common peroneal nerve, which supply the lower leg. Coccygeal plexus. The coccygeal plexus is a very small plexus formed by the part of fourth and fifth sacral and the coccygeal nerve. The nerves from this plexus supply the skin around the coccyx and anal area.
My student support system. Keep watching, keep learning.